Hi, I'm Dr. C. Suman Kumar. I'm consultant pediatrician at Ankura Hospital for Women and Children. Parents are always concerned regarding the speaking ability of a child. They connect that in a child who speaks earlier is more smarter, and the child who doesn't speak earlier is a dumber child. This is what usually they consider, and they're always under pressure. See, my advice as a pediatrician would be, don't worry about their talking and walking, because once that starts, your trouble only doubles up. But cutting the jokes apart, how to know what is the right age for a child to talk and how the child would be? We need to understand that speech is of two varieties as far as the development of child is concerned. One is the receptive speech, one is an expressive speech. What is receptive speech? Receptive speech is understanding the language around the child. What are the language? He has to understand your commands. Whatever you are communicating with him in normal language, the child is supposed to understand and replicate it. He has to follow your commands. Once he is following your commands, whatever you are saying indicates that he already knows the language, only he is not expressing it out. So the first 2 years goes only in proper development of receptive speech, means he can understand at least 4 languages. If he is doing it, even 1 to 2 languages, the job is done. Expressive speech comes over a period of time, provided a right environment is present around him. What is the right environment? Right environment is not giving him enough screen time. He should be spending more time with us rather than with tabs, mobile phones and televisions. What happens in tabs or mobile phone televisions, though there will be a lot of nursery rhymes, it will be a different language for the child. That cartoonish language, that squeaky language, that English will be confusing the child. That language will be totally different. And second, you should always communicate with the child in the same language as you communicate among yourselves. You should not spoken in jargon language or baby language, cutting down the words with him. Speak as an adult to another adult to him. Treat him as an adult when you are speaking to him. In that way, that baby will pick up language much faster. Third is, stop understanding the sign languages of the child, because children like to communicate using a sign languages. Moment they show a sign language, you bring that object, the demand is met, the child need not express himself out. This is the problem with smart mothers. They try to understand, smart parents rather, they try to understand the sign language so faster the child never needs to express himself. Until unless the child enters the school where the other child doesn't understand, that is only when the child starts to express himself. So if you want your child to express themselves, then stop understanding their sign languages. Make them express, act dumb in front of them, so the child expresses ultimately in language so that we understand. So there are 3 simple steps to make a child talk earlier than they are, and no need to worry as long as they are understanding your language. Keep one language of communication. Don't try to teach too many things to the child. Language cannot be taught. Language is always learned over a period of time by observing in proper environment. When is the right time to stop breastfeeding for the child? When is the time when the child can be fed on other feeds? When is the time when other milk can be introduced? To answer these questions, the common question is, exclusive breastfeeds should be given till 6 months of age, no doubt about it. The solid should be introduced at 6 months of age, but the breast milk can be continued till at least 18 months of age. IAP recommends till 2 years of age considering the social strata, but as pediatricians we would recommend at least till 18 months of age the baby should be given breast milk and no other milk should be given. Okay, this is something which we need to keep in mind for appropriate development and appropriate appetite for the baby instead of giving other milk. And no supplement should be given till the child reaches 2 years of age. No milk supplement should be given till the child reaches 2 years of age. How much milk to be given? This milk is always decided by the quantity, is always frequency is always decided by the baby. It should be given on demand and how much ever the baby wants. And once the baby is given, the baby should be in a position to be quiet for at least 2 months, especially for babies who are less than 6 months of age. And solids can be given intermittently. Solid feeds can be given intermittently once the baby crosses 6 months of age. Thank you.